Hello, everyone. My name is Richard Wylie, and I'm the Chief Executive Officer at Glaucoma Australia. Very pleased to be with you this evening. We've got a really fantastic session tonight. As you can see, we've got a number of faces on screen. It's the largest group I've tried to moderate in this format, so hopefully it all goes well and you all find some really interesting insights. The title of the presentation tonight is "Who's on Your Team? A Patient's Eye Care Support System." And let me go around the room and introduce each one of our special guests this evening. Firstly, in my top left, we can see Mara Giribaldi. She is an orthoptist and associate lecturer at the University of Technology in Sydney. Then we have myself in the middle, and then we have Khanh Nguyen, and she is a community pharmacist and acting senior manager at the Pharmacy Guild of Australia, based in Queensland. Then we have down in my bottom left-hand corner, Luke Arundel, who is the Chief Clinical Officer at Optometry Australia. And finally, Dr Geoffrey Chan is an ophthalmologist whose area of specialty includes general ophthalmology, glaucoma, cataract surgery, and laser. So thank you, everyone, for being with us tonight. I should also say happy World Glaucoma Week. We've had a very busy week here at Glaucoma Australia, particularly for those of you who tune into these live Q&As. I think it's the fourth Q&A we've had this week, and it's only Wednesday evening, so we've still got another one to go tomorrow night. So why don't we kick off now? So it's going to be very conversational, this one, very much a conversation between us all. So why don't I start off and listen, this is me. I actually went and had my eyes tested 2 weeks ago. There you go. And I went through the whole battery of tests. So maybe I've got a little bit more knowledge than I might have had 6 months ago. But let's just start. Who is the best person within this circle of care to approach when a patient needs advice, for example, on eye drops and maybe they're experiencing some side effects? Mara, why don't we kick off with you?
Sure. Look, I think, as an orthoptist, we can provide information on many of these things, and eye drops is one of them, and their side effects. A lot of the times, the team that we work with, the ophthalmologists or the shared care, patients are on eye drops, and they may come in with a presenting reason or a chief complaint of sore eyes or some sort of an allergy or something like that, or something they've noted. It's up to us as clinicians to know a little bit about what the treatment is and what these side effects could be. Of course, if there is some discrepancy in regards to the questioning or uncertainty in regards to how best to answer that, as part of the eye care team in our workplace, we very often you find orthoptists working with eye doctors in their ophthalmology practices. So your treating doctor or the doctor that you're seeing or will be seeing if you're heading towards potential treatment or eye drop use, we can ask them, and the information is I guess shared amongst the initial part of your consultation, and embellished as you go through your journey at the eye specialist. So I think it's important to know what someone should expect and what you might expect by somebody on a particular eye drop in the conversation with you through a history taking. Yeah.
And just for those people, because I remember when I started at Glaucoma Australia, obviously I was very familiar with optometrists and ophthalmologists, but an orthoptist, could you just tell us maybe just briefly what orthoptists do, and also I guess where they fit into the circle of care that we're discussing tonight?
Absolutely. So orthoptics is an allied healthcare profession. In Australia, there are two schools or universities that actually do produce orthoptists, and one is in Melbourne at La Trobe, and where I work some of my week is at UTS. It's a master's course. So the students I'm familiar with are master's students. They've already done an undergraduate course. So by the end of their studies with us at UTS, they would have done 5 years of study and have become orthoptists. So orthoptists work in collaboration, can work in their own private practice, but in collaboration mostly. You will find orthoptists in ophthalmology practices, in hospital eye clinics, in community, in NGOs, similar places like Guide Dogs, Glaucoma Australia. We have orthoptic educators there that talk to patients who have glaucoma and need support in their journey. and also Vision Australia. So should someone get to a stage where glaucoma in particular creates a vision impairment or a difficulty seeing, orthoptists can work in that low vision rehabilitation area as well to better utilise residual vision and make the most of what that person's visual capacity is.
Great, thank you. All right. Why don't we go back to the very top? So let's just imagine someone is a glaucoma suspect, or there's someone with confirmed glaucoma. At what point in their journey will they be engaging with each of your respective professions, and what type of support can they expect from each of you? Luke, should we go with you first? Why don't we go to you?
Yeah, certainly. And look, that's perhaps appropriate because often we're there right at the start of the journey. So as primary health practitioners, your basic checkup at the optometrist is often part of where a glaucoma patient is diagnosed. We know it's the sneaky thief of sight, and we know there's many hundreds of Australians every year coming in for routine eye care, coming in for a routine pair of glasses, and having a diagnosis of glaucoma made. So we're there at the beginning. We will often support a patient on the journey through. And this care, we live in a beautifully diverse and very geographically broad country. So, the experience is going to be a little bit different depending on where you are and how close you are to a major capital city or to other care. But we will obviously support you through the way. There's a lot of co-management happening around the country, which is obviously fantastic. So we may be seeing you in between your ophthalmologist or your specialist visits, and it may be to conduct things like measuring the pressure inside your eye, or conducting visual fields or scans of the retina layer, that layer at the back of the eye. We'll support you with visual aids, whether it's something as mundane as just a pair of glasses or contact lenses, or further on down the track, perhaps with visual aids for low vision if necessary. So we're pretty much there along the journey. And of course, if there's any problems in between, we're very accessible. There's around 6,000 optoms around the country. We're fairly well spread out. So that's a very broad answer, but hopefully that helps, Richard.
Yeah, I guess in terms of access to healthcare in Australia, there's pretty much an optometry on, or maybe even 3 or 4 on every high street in Australia. So being able to just simply walk in the door and request an eye test is about as accessible, I guess, as it gets. So why don't we sort of go along the, the continuum of what happens next. So you see someone, you've done your tests, you suspect that there may be some glaucoma at play. And one of the things I've learned during my journey since joining glaucoma is it's not a really easy diagnosis, is it? There can sometimes be some sort of false positives and some confusion around the diagnosis. So what happens for you next? Is this where you refer on to an ophthalmologist?
Yeah, absolutely. So we work very closely with our ophthalmological colleagues, and that will be the next port of call for confirmation of diagnosis and commencement of treatment.
Brilliant. All right, Geoffrey, it sounds like you're on. So what happens? So you've had a new patient referred to you. The friendly optometrist has said that they think they've seen something that's worthy of a second look. What's your role then, and what sort of conversations are you having with the patient?
Yeah. So as the ophthalmologist, in terms of the patient's journey, we're there, as Luke mentioned, really just to confirm that diagnosis. Often, glaucoma itself is a really broad kind of area that really pertains to degenerations of that optic nerve, and there are multiple different causes of that glaucoma. So our job will really be refining that diagnosis, making sure that it's something else that could be, causing degeneration in the patient's eye or affecting their sight, and to really give confirmation of that diagnosis. Another part of their medical treatment is really initiating that treatment for a patient who's got a confirmed diagnosis of glaucoma. And sometimes that is done by our optometry colleagues, like Luke. These patients can often be already started on medications from the optometrists, where there's a really high index of suspicion of glaucoma or nerve damage or something's going on. And so basically we'll decide whether or not that treatment needs to continue or needs to be escalated. The other thing that we do is really work out the velocity of the patient's glaucoma progression. So, really there's quite a few people that don't know they have glaucoma, where it might be affecting their sight. And one of our jobs is to really ascertain how much this patient is at risk of developing significant progression of their glaucoma over time, and just how fast that nerve degeneration might be going on. So we'll often have a few visits with the patient there just to establish that. And depending on how that patient is, whether or not they're a patient who's at low risk of developing glaucoma or is a stable glaucoma patient, those are often patients that we'll co-manage with our optometry colleagues as well in shared cared approaches.
Great, thank you. That's fantastic. And I talked about the accessibility of optometry in Australia, which is absolutely fantastic. But even more accessible than that is your local pharmacy and your local pharmacist. And quite often you have a very meaningful relationship with your pharmacist. So I guess this is where you come in, Khan. I mean, talk about the typical sorts of, I guess, dialogue, advice, conversations you're having with patients who have either recently been diagnosed with glaucoma or are managing their glaucoma quite successfully.
So usually, thanks everybody, but usually we see the patient, I guess, towards the beginning of their diagnosis sometimes if they've been prescribed medication. So I think for us, it's really important to reassure them as well, because sometimes by the time they've left the ophthalmologist, they might have had some afterthoughts, and that's quite normal. By the time they get to us, they've got all these questions that they wish they'd asked the ophthalmologist. So I always like to, obviously they ask a lot about the medications. I want to know about the side effects. I want to know if they can take it with all their other medicines. And usually some of them do have underlying conditions. So even before that stage, like say if somebody had presented earlier with something, to do with diabetes, you kind of sort of see that this is probably, like if you kind of you can intervene earlier and be encouraging them to get some regular eye checks and start that journey if they haven't already thought about it, because I think sometimes they can feel really overwhelmed. So basically we go through the medications, the side effects, offer the obviously some support. We can then refer on, because I always love to refer on to any local optometrists, say if they have any issues in between, just again for somebody else that's accessible in the community. We have really good relationships where I've worked with the optometrist, and then I like to encourage them to keep a diary of things that they want to ask, and I think that's really important, whether it be their medicines or just general things that pop up. But I think that, because they come in generally monthly, because a lot of the eye drops expire, obviously within, they need to replace them every month. We have that continual care, and it's up to us to make sure they're compliant. If they're not coming in monthly, I get a bit concerned. So just checking in and obviously encouraging them to book in for that appointment if they missed it, encouraging them to rebook, that sort of thing, and putting reminders in their calendar. But I think there's lots of things that we can do at the pharmacy level, just because we do generally see them more often for their medicine.
I think that's absolutely right. And I guess one of the things, firstly, I think there's a lot of value in what you were just saying. I think one of the things that's going to come out of this discussion tonight is kind of emphasising messages that may well have been communicated by different stakeholders throughout their journey. And I can imagine, it's great that they've got a relationship with the optometrist, although for most people that might only mean going there once every 6 months, once every 12 months. And that's still a decent period of time not to be communicating with your optometrist. Geoffrey, again, ophthalmologist, probably, what's the sort of frequency you're looking to see people? You said maybe a few times in the early stages, but generally, again, that 6 to 12 month sort of time frame.
Yeah, so really how often we end up seeing the patient is a reflection on how worried we might be about the patient and their glaucoma. So generally patients with more severe glaucoma might be seen every 4 to 6 months. to make sure that they aren't losing any of that vision further. But in terms of stable patients, yes, they generally are seen between 6 to 12 months with their ophthalmologist. And if they're really stable, perhaps every once a few years, if there is a shared care model where there is a good working relationship between the ophthalmologist and the optometrist.
Absolutely, and I guess it's we need to emphasise the importance of continuing to take their medication. So for many diseases that we might be diagnosed with, you generally do one course of medication, and then you feel better, and then that's it, and you're cured, and then you get on with your life. But I guess it's an important message and something that you can all emphasise, particularly the pharmacists, to say, listen, this is therapy that you're going to need to stay on for a long time, maybe even lifelong therapy. And so the importance of, making sure that people are doing what their healthcare professionals are asking them to do, gives them the best chance of preserving that sight. I mean, what about you, Mara? I mean, how often are you seeing people, and generally, what are the sort of messages that you're emphasising?
Look, I think, following on from what Dr. Chan said, routinely the glaucoma patient or glaucoma suspect patient might come 6 to 12 monthly. So if an orthoptist is working with the ophthalmology team in their rooms, usually there's, that first point of call, and also picking up on what Luke was saying as well too, that initial testing, the scanning, the eye pressure checks. There's a lot of overlap what optometry does in the primary, sector, and, the secondary where the referral goes on to. So that patient journey, it might feel a little repetitive for, your glaucoma patient to have the same things done. But, the importance of every 6 months making sure there isn't any progression or looking for stability, the testing, the scanning, the assessments that we do that might feel like a waste of time, or I'm not doing the field test again, or things like that might feel a little unsure to the patient as to why we're doing them so often. But it only takes, a little bit of change to lose the nerve fibre at the back of your eye to create or lead you to having a vision problem. It's really important for glaucoma sufferers, or to have people who have glaucoma in their family or family history, or a suspect in that category of developing glaucoma, to be aware of, and importantly, keeping their appointments. And sometimes, like Doctor said, it might be 4 monthly, or that shared care model, that if someone can't come to the eye doctor, really important to keep that up. Even though there might not be some change, it's important to make sure that you're not losing sight, the sneak thief of sight. You're unaware of having side vision loss, or slight subtle changes, and our machinery and our scanning diagnostic testing can pick up on those and lead to managing something that is not going to get out of control.
Well, that's the perfect segue to my next question. But listen, I think you make a really, really good point there. We know that this is a progressive disease. We know that there's no cure. Unfortunately, once we lose the sight, we can't turn it around. We can't go back to where we were 2 years ago. So what I try to say to people, even if it's just friends and family members, is go and get your eyes tested. Make sure that you continue to go and get them tested, and particularly keep up with the appointment schedule that your healthcare professionals are recommending. And as you say, Mara, even if you feel like these are tests that you've done before, what they're actually looking for is progression, and maybe the treatment that's been working for you over the last year or two or whatever is no longer working for you, and maybe we need to think about some other options. So this is the least qualified person on this call making those points, but I think the points you're making really are very, very well made. Luke, let's talk about the tests that people are given. Like I said, I had them done 2 weeks ago. I must say, I found the visual field test quite tiring. It takes a lot of concentration, and of course, I'm a very competitive person. I don't want to miss anything, so I was sitting there concentrating with all my heart, trying to make sure that I got all the dots. So talk to us about the sort of typical test that people would expect when they maybe walk into an optometry store.
Yeah, no worries. But before I do, if I can just circle back very briefly to close off something with respect to timeframes, please for the patients watching, don't feel locked into 6 months. If something's not right, or if you are having side effects, as you can see, you've got a team of professionals, that are very concerned about your visual well-being. The key thing is, making sure you tell someone. So, you don't have to wait for your 6-monthly visit with your ophthalmologist if you're getting red, itchy eyes or having problems with dryness. The key thing for me is please tell someone so that we can get to work on it. But back to your question, Richard, look, there's a battery of tests, that are glaucoma related at the end of the day. So if we think about glaucoma, in obviously one of the most basic forms, we would consider the pressure inside the eye to be high. So measuring pressure is one of those tests. So there's many different ways that this may be done by your eye care practitioner. One of the ways could be a puff test, a little puff of air. It may be an eye care practitioner puts some drops in and comes up quite close with a little blue light, or perhaps something that might make a little bit of a tiny puff of air sound but doesn't really feel at all. So pressure testing is obviously integral to glaucoma management. The visual field, as you mentioned, look, I find them very boring myself, but they have gotten a lot better. The algorithms or the processing power behind some of these, or the maths, basically, we've been able to shorten these testing times quite significantly. So I appreciate that you probably felt it was like watching paint dry, for the 2 minutes and 37 seconds or whatever the CETA fast tests can go for. But please understand they're a lot better than they were, and potentially, we may see further improvement in these along the way as well. So it does depend a little bit on how much it needs to come back and check. What I would stress perhaps with visual field, something that, my own mum stresses about, don't worry if you feel you made a mistake. The computers and the algorithms are very good at this. They will come back and check. And, if you need something as simple as to have a break, please tell your eye care practitioner. I can remember doing an eye test for a very dear old lady, and she had an eyelash in her eye. She just soldiered on all the way through with tears streaming down her eye because she didn't want to get it wrong. She didn't want to make anyone unhappy. We could have paused and we could have got that eyelash out. We could have gone back to it very simply. So, keep in mind, look, it's not rocket science. We can come back to it. They're very good at double checking, and there are little I suppose tests built in to make sure that you're paying attention, that you haven't fallen asleep at the wheel, and that your responses are reliable from a scientific point of view. So hopefully that will give some of the viewers today a little bit of reassurance that these things are pretty good these days. Moving on in the glaucoma space, obviously there's a good old-fashioned examination of the back of the eye, or the retina with the human eye. Maybe involved using a lens, or coming up very close with something called an ophthalmoscope. And of course, as we move on into the 21st century, as technology moves along, we also have a raft of scanning machines, that are able to section or slice and dice, if you will, the retina, or that sensor layer at the back of the eye, and provide some really incredible information about nerve loss, be able to compare it to a baseline of normals, and to be able to suggest, look, this person may be starting to lose some cells that are responsible for vision in this particular area. And we like to be able to compare that back to, are we seeing a visual field loss in the same area, or do we see a defect in the optic nerve, the nerve that carries the information from the eye back to the brain in that same area? So, as scientists, obviously we like for these things to correlate, and that's part of the puzzle and part of the big picture when building up a glaucoma diagnosis. So they're probably some of the top tests, if you will.
And so, Geoffrey, we'll move on to you. So often when you do get to the ophthalmologist, they'll quite often want to repeat those same tests. Now, is this because you guys have got more expensive machines, and or is it a case of just wanting to either confirm or see yourself, what's going on, or what's going on there?
Yeah, so confirmation's a really big thing. So we know that with the visual field tests and with some of those tests, they really can get subjective kind of fluctuations in that test. So there's I always repeat the test, and it's really useful when a patient has their results sent from their optometrist to me, so I can look at the patient's results and see if on that day they see me, they're performing the same. Because if they do, then I've got a lot more confidence that the test result that they've given us is a true reflection of what's really going on. So that's certainly, really useful. Look, in terms of the scanners, there'll be kind of different scanners available, and depending on the optometry or ophthalmology practice, these equipment might be either more or less kind of fancy or modern. It will really depend on the center, but certainly we, as Luke mentioned, we really do have very good technology nowadays that's able to kind of perform baseline measurements and to follow up that individual patient over time to really track on the micron level whether or not there are changes that are happening even before that disease really manifests. And that's the beauty of catching glaucoma early and treating it in its early stages.
The progression, that's right.
Yeah.
All right. So,
Mara,
sorry, could I just add to that? Just from
please do, Mara. I was going to ask you actually to talk about tests, so thank you.
From a patient perspective, the reasoning why we may need to repeat them at the ophthalmology rooms once I've already done a similar type test. A lot of these machines have got a follow-up function or a repeatability scan, so we can compare exactly from your previous visit to today's visit, and they produce reports for predictability and for reliability and for change analysis. So that may be another reason why you are requested to have another scan or test done that's similar, so that these reports can be produced so that the doctor can then have a better idea of how your eyes are progressing, whether they're stable or whether there is any subtle change. And it's the subtle change that you don't want to miss for down the track, so that you can maintain as much optic nerve function as possible.
So while we're talking about tests, if I'm undergoing tests, are there any specific concerns that a patient should be reporting to their ophthalmologist during the tests? And I'll ask you again, Mara, you're the...
Sure, yeah, absolutely. It's important to get the most out of your visit and not to feel like it's a chore or that it's a frustrating time, especially with the field test, as we've talked about. But just generally, orthoptists like to communicate. I personally do appreciate the honest patient who tells me that maybe they're not quite comfortable when they're sitting on the field test before starting. It's not in 5 minutes that it's done. Sometimes it is, but it's a long time. 5 minutes feels like half an hour. So it's really important for you to communicate that you, at the starting point, feel comfortable, that you understand the instructions that have been imposed on you. Do you want anything clarified before the machine turns on and are in testing mode? If you want anything clarified, before the test starts, that's the time to do it. If you tell us later, or like the example that you gave, Luke, classic, you might have to repeat the test because it created reliable statistics. You might need to repeat it. So once again, it will take longer. It'll make you more exhausted. There are things that we can modify and chat about during the test. As Luke mentioned, we can guide you as to how you're performing. You don't have to have in your head, you have to get every light. It's not expected that you see absolutely everything that the machine presents to you. So there are periods of time where there is nothing, and that is normal. So don't let your mind race away, I guess. I think it's lovely for you to sort of communicate if you're worried about not seeing anything, and we can reassure you that that could be normal. The other big thing is about drop usage and compliance. I guess, when discussing how you're going with things, if for some reason you're having trouble instilling drops, or you miss your eye when you try to pop it in and you don't know whether you should put another one in, or it's best to let us know, or, if you find it difficult to squeeze the bottle, there's things that we can help you and tailor for you that works for you. If you don't tell us, we can't help you.
Yeah, it's great advice. And speaking of drops, this is me being very naive here. Who can actually write the scripts for the drops? Is it the ophthalmologist initially, and then maybe the pharmacist can help with repeats, and maybe even how does it actually work currently with eye drops? Go to Geoffrey, to you.
Yeah, so with the eye drops, your optometrist can initiate the prescription Luke can speak more to this, but there are therapeutic courses available so that optometrists can continue and initiate the prescriptions. In terms of the prescriptions ongoing, that's it typically will be your ophthalmologist that manages the eye drops and really tailors that so that the eye drops are working and also compatible with the patient and not causing too many side effects. Khan pointed out.
That's great. Do you want to add anything to that, Luke?
Yeah, look, the other avenue, if worst case scenario comes up, in theory, your GP is also eligible or able to write that prescription, but they certainly don't have a lot of the ocular data or the perhaps working blind, if you will, when it comes to that sort of scenario. So, I would certainly stress, if you're getting close to running out of medication or have run out of medication, don't stop. Again, talk to one of the team. Any of these professionals here should be able to help or at least point you in the right direction to sourcing more drops.
Great.
Yeah.
Absolutely.
And to clarify that point, yeah, that's right. So GPs, they typically won't be the ones initiating that medication, but being members of the team in terms of your health and your medical health, they'll certainly be involved in the kind of decision-making processes and be informed about any prescriptions. I'll actively write letters and make sure that I include, any patient's optometrist and GP, and to make sure they know about any ongoing prescriptions and any changes to the patient's eye drop prescriptions over time.
Oh, brilliant. Oh, that's great.
So, GPs, your general practitioner should really be kept in the loop. And often they are an avenue to go to if you've run out of eye drops in between.
And what about you, Khan? Have you got anything to add there in terms of, repeat scripts and experience with eye drops, any, side effect issues? I mean, what are your experiences in that scenario?
Yeah, so I guess we sort of see pretty much all of those scenarios. So from, queries about side effects, I might go home and read the information leaflet inside the bottle, inside the box, have some queries about that. And I think my favorite thing is they've Googled things. So Dr. Google.
Dr. Google, yes.
Yep, Dr. Google is their best friend these days. And it's unusual because sometimes I will actually type in myself into Google and just have a better understanding of what they might have read before, but I'll ask them to pop in and, we sort of have a bit of a consultation. And again, it's just reinforcing there's a lot of information out there. There's probably a lot of misinformation. So looking at things like, looking at evidence-based medicines and journals and things like that. And obviously sometimes I think there's a genuine fear sometimes as well, anything that's unknown to them. So just making sure that they're reassured. And yeah, but I like to sort of prompt people maybe when they've got 2 repeats left to start, booking in for an appointment, especially if they're due for an ophthalmologist one in particular. Otherwise, obviously the GP can obviously in the interim, but sometimes people will come in and they'll go, I just want to pick up my repeat for this, and they've run out or it's expired, or there's lots of different scenarios that happen. And I guess it's up to us to, ensure that their care is, and I guess the compliance is, still adhered to, so we can continue that. And there's been a lot of, there's been some, just in the last few years, I guess, some shortages, eye drops being unavailable. People are traveling again, so they want to know, how do I store it? Can I take, 3 months at a time? Can I buy things, in, I don't know, like Indonesia, things like that. So you get all sorts of questions, and it's up to us to, I guess, preempt them, because it might be, 2 days away. They're booking in to go they're booked in to go somewhere, and they haven't actually thought about all these things in between. So just not suggesting that they purchase anything overseas without some sort of being prepared, taking enough supply, and then us educating them on just how to store their medicines and things like that, and like making sure that they've got devices if they're used to having devices. We have people that have a fear of putting their own eye drops into their eye, so then educating a family member to do it for them. So there's lots of different scenarios. I'm sure that Mara could probably resonate with some of those scenarios too. But yeah, we're presented with quite a few things, and I think it's just finding some workable solutions as well. I think is one of our key roles, and then encouraging them to, obviously follow up with the ophthalmologist, the optometrist, and everybody in the team.
Fantastic. Thank you. We're very lucky in this country, aren't we? I mean, we have a fantastic health system. The fact that all of you are on the team supporting the patient throughout their glaucoma journey is wonderful. And I probably should take this opportunity to say that also Glaucoma Australia provide a free service for anyone in Australia that's been diagnosed with glaucoma, and it can be accessed either via our website, or you can call our 1-800 number at any time, which is 1-800-500-880. And we've got some fantastic clinical educators who will talk to you on the phone. They're more than happy to talk to you. You can call us. Sometimes they also make diary notes to call you after you've had a checkup with your health specialist. And it's a fantastic service they provide. I mean, I think about it like a concierge service for your glaucoma. It's at no cost to the patient, and I'm very, very proud of that program. So I think that what we're getting out of this session is there's always someone to talk to, and we're very, very lucky that there are so many people available to us. So if you do have any questions, you should be sure to reach out to your healthcare professional and communicate with them around what your concerns are. But I noticed we're sort of 36 minutes into this session now, so I think I'll probably start winding it up there. But just wanted to thank you all very much for participating in this session tonight. It's been absolutely fascinating. I've learned a lot. And I'd also like to take this opportunity to thank very much our sponsor for these live Q&As in 2023, and that is Glaucus, a wonderful, innovative company that's been kind enough to provide us with some sponsorship to help make these sessions possible. So thank you very much, Glaucus. So just want to thank you all one more time for your participation. Thank everyone who's been tuning in out there. A very happy World Glaucoma Week, and we look forward to seeing you in the next session, which may well be tomorrow evening at 6 p.m. So looking forward to seeing you then. So thanks, everyone. Really appreciate it.
Pleasure. Thank you.
Thanks very much.